Our topic is implementation of free water protocol for patients with stroke and dysphagia in acute rehabilitation setting. Dysphagia is the term used to describe difficulty swallowing. This is a common problem for patients with stroke. Dysphagia affects up to 67% of patients with stroke. For 50% of those patients, swallow difficulty may resolve within a week. Another 50% are left with lasting deficit. A free water protocol was developed at Fraser Rehabilitation Hospital in Kentucky in 1984. A speech pathologist on Fraser dysphagia team became concerned by lack of compliance with patients on thickened liquid diet and resulting dehydration. I work at NYU Langone Medical Center at Neurosciences Unit. I take care of patients with stroke and dysphagia. Many of these patients are on thickened liquid diet. I see patients taking few spoons of thickened water or juice and refusing to drink more. So in the hospital we usually use a packet thickener, but this is a can thickener, which is called Thicket. We use it to thicken, obviously, water or juice for the patients. So on a can it says that it brings joys of eating back to people with swallowing problems, called dysphagia. It also says that it doesn't change consistency of the or taste or appearance of liquids and fluid. It thickens. So I just thickened water in here, and you can see it changed consistency. And if I taste it, it has starchy taste, so I don't blame patients for refusing drinking it after a few sips, a few spoons. The free water protocol allows patients who are known as aspirators on thin liquid to drink water without developing aspiration pneumonia. This protocol is based on research that water has a neutral pH, and unlike soda or coffee or juice, even if it is aspirated into the lung, it will be quickly absorbed into bloodstream and does not cause aspiration pneumonia. Aspiration of water, in fact, is a benign event. There are three complications of dysphagia, and first one is aspiration and pneumonia, second one malnutrition, and third one is dehydration. Prior to development of protocol, the focus of dysphagia management was on aspiration pneumonia. Protocol shifted focus to hydration, which is not benign event. Dehydration is probably one of the most misunderstood conditions by healthcare providers and general public. Actually, nutrition literature says that a large segment of population is at least mildly dehydrated. Dehydration increases risk of further stroke for patients with previous strokes. Dehydration also can lead to a variety of negative health conditions such as lethargy, confusion, weakness, constipation, infection, poor wound healing, pressure sores, altered cardiac function, declining nutritional intake, confusion, urinary tract infection, renal failure. Dehydration leads to lethargy, and more lethargic patients are dependent on tube feeds. And tube feeding is known to be number one risk factor for developing aspiration pneumonia. So this creates vicious cycle between dehydration and aspiration pneumonia. So well-hydrated patients have stronger immunity, well-hydrated patients are happy, won't refuse therapies, are comfortable, and will eat better. The Fraser water protocol is simple. The most important guideline of the protocol is that patients are only allowed thickened liquids with meals. Free water is permitted only between meals, and patients should wait approximately 30 minutes after meal before taking water. Nurses perform a check of a patient's mouth between meals to make sure there are no food particles present in order to prevent aspiration pneumonia. Medications are also not allowed with water. Patients should take it with apple juice or yogurt, as pills may be washed into the lungs. One of the key components of the protocol is not that patients just get water, but they're offered water on a frequent basis. Patients usually have a wristband which says that they're water permitted. And patients are still monitored for signs of aspiration pneumonia, for high temperature, positive chest x-rays, and elevated white blood count. So the success of water protocol calls into question the use of thickened liquids.
Okay. So Irina just finished telling you about why this is an important topic to us, and I'll just be going over some of the results from our literature review. There are several rehabilitation methods to help patients suffering from dysphagia post-stroke. The use of thickened liquids is by and far one of the most popular treatments. Others include improving range of motion and feeding via nasogastric or gastrostomy tube. There's debate about how to manage those with dysphagia while maintaining nutrition and hydration in patients. Despite the popularity of using thickened liquid protocols, there's insufficient evidence that thickened liquids reduce the risk of aspiration pneumonia. A few studies suggest the links between oral health and pneumonia may be more significant than only the diagnosis of dysphagia. Some studies even indicated that those who aspirate on thickened liquids are more likely to develop pneumonia than those who aspirated on water or thin liquids. When the water protocol was tested, even in those with known aspiration on thin liquids in the past, including water, in their diet was not an increase in the incidence of aspiration pneumonia. To be included in the protocols, the regular examinations by speech therapists, oral exams, and barium tests were used. Those who passed that hurdle were given ice chips and water to see if they could swallow, and then water was included in their diet. Water was given in between meals and after oral care. Incidences of aspiration pneumonia was actually higher in the group that did not get to drink water. The aim of all these studies is not to replace thickened liquid therapy, but to give patients a wider variety since there are high rates of dissatisfaction with only having thickened liquids. Use of water might not be detrimental since the lungs can clear it out better than other liquids. An example of this would be someone who survived a near drowning. Some research found that although thickened liquid protocols get cited as a reason why post-stroke patients tend to be dehydrated and not getting the appropriate fluid intake due to dissatisfaction with the taste and consistency, insufficient fluid intake is still a problem for those allowed thin liquids. More research is needed is said a lot, but in this case, the researchers are right. The research is relatively minimal, and the current medical and nursing establishment is not researching other methods in dysphagia treatment in relation to aspiration. The research so far is promising. Adding water seems to be more beneficial than harmful to post-stroke dysphagic patients. And now I'd like to turn it over to my colleague, Rachel Vanya Velasco.
As mentioned earlier, water protocol is in the beginning stages of being researched. There is still much that needs to be known before a nationwide change in practice can occur. However, the research done is promising, and it's exciting to think about the practice change that this could bring to medicine. As nurses, we are constantly burdened with the current practice and the want to improve quality of life. This is one primary example of this struggle. Current practice tells us that the need to prevent aspiration pneumonia is most important when assisting patients with dysphagia. However, being at the bedside and watching the patient with the discontent and the inability to follow this protocol leads to this internal struggle that most nurses have. With the promising results of these studies, this becomes one less thing to struggle with. We as nurses right now use our judgment in mixing thickeners into liquids to a honey or nectar thickness. This subjective approach has led to the over-thickening. Since water protocol is not intended to replace thickened liquids, these findings need to be addressed. The use of a viscometer could help in this situation. The use of the viscometer, as research showed, didn't decrease aspiration, but did help in the consumption of the liquids, meaning the thicker the liquid, the less likely we are to drink it. On inclusion of water into the dysphagic diet, education will become a necessity. The protocol that has been researched and tested so far requires the use of numerous specialties communicating frequently. Nursing will have to have further training on assessing aspiration and reacting to it appropriately. There will also be a need for close documentation on intake and output, which will require much needed training with the nursing assistants to be participatory in this part of the patient's care. Another very important group that will require extensive education are the families, friends, and caretakers of the person with dysphagia. The protocol allows for free water until mealtime. The use of thickened liquids is still necessary from the first bite of food until a minimum of 30 minutes post-meal. The need to not bend this rule is key in the success of this protocol. Another major factor to success is the initiation of adequate oral care. As mentioned earlier, there is a stronger correlation between oral care and pneumonia as opposed to aspiration and pneumonia. From a nursing perspective, the potential of this research is exciting. If the results continue to be as positive as the study already done, the quality of life for patients with dysphagia will forever be changed in such a positive way. Thank you for allowing us to present to you on the water protocol. Get better!